Indiana University School of Medicine is the largest medical school in the country. That plus the fact that Riley Hospital is the only comprehensive children's hospital in the state, there is just a tremendous amount of patients from which to learn from.
The field is actually growing, and to put it in perspective, when I started, you could count the number of pediatric gastroenterologists on your fingers, and now there's a large group of pediatric gastroenterologists who are just doing research and identifying the causes of some of these diseases that we had no names for.
One of the things that makes pediatric gastroenterology intriguing to those of us who chose this field is the large amount of procedures that we do.
Our goal is to make them a pediatric gastroenterologist. In other words, train them to become comfortable in clinical settings. And so the first year is all clinical stuff. We don't ask you to start going, doing research in your first year. So your first year, you're going to be a clinician, seeing patients.
It's very important as they learn to practice outpatient medicine in our specific subspecialty, to do so with more supervision at the beginning, with graduated autonomy over the 3 years. One of the things that we pride ourselves on at Riley Hospital is the integration of all of our learners, be that medical students, residents, fellowships from all disciplines, and even learners from other schools, for example, the School of Nursing, pharmacy, and so on. As these trainees graduate and go out and practice medicine, it sets them up for unique success because they've already worked for 3 years, 4 years, 5 years, in an environment in which all of these opinions are valued from all of these different fields.
We want the fellows, once they're done, to understand the concept of ownership of the patient, right? So this is my patient, and a lot of GI problems are chronic problems, so we don't cure them, we manage them over long periods of time. So patients with inflammatory bowel disease, they're going to be our patients until they become adults and leave. So we want to cultivate that kind of mentality in our fellows. And so right from the beginning, you get your own patients, in your continuity clinic, and you're going to follow these patients until you're done with your fellowship. Okay, so you see the patients progress the way they're going to progress.
One of the best things about our fellowship program is our commitment to education. All of our fellows are involved in education in some way, be that teaching at patient and family events, teaching residents, teaching medical students, and the like. It's very important to us that our fellows graduate and know how to teach. The second half of their fellowship, the bulk of their time is dedicated to research. We have fellows who participate in educational research, and probably the most common thing that we see among our fellows is participation in clinical research. All research pursuits are guided by a panel of mentors, which really helps guide the fellow throughout those 18 months of research with the goal of producing a work product that's publishable. Our fellows can elect to spend time in what we call the super subspecialties within pediatric gastroenterology, be it weight management, motility disorders, allergic bowel diseases or eosinophilic disorders, and hepatology and the like. And we completely leave it up to the fellow to choose what they would like to rotate through.
We're all a family. We do things together, and and that I think it's been that way, and that's the reason why I'm still here, after so many years.
Some fellows stay on as faculty once they finish here, but when other fellows spread their wings and take positions all over the country and for that matter, the world, we always consider them to be part of our Riley Hospital family.
That's one thing that I think I'm very proud of, in the program here.